Good afternoon. My name is Abby Kosan, and I'm the Executive Director of Kupona Foundation, which is a US-based nonprofit committed to empowering people through access to quality healthcare in Tanzania. We do this by working directly with our sister organization, CCBRT, which is the largest provider of quality disability and rehabilitative services in the country and a key partner in the fight to improve maternal and newborn healthcare to the government of Tanzania. Today I'm here to talk about one of our lessons learned and how healthcare providers in low resource settings can learn from the Toyota production line. CCBRT was faced with a challenge with demand, as many healthcare providers are. Many of you today are familiar with the Global Safe Surgery Challenge. An estimated 5 billion people worldwide don't have access to quality surgical care. Of these, people who actually have access to surgery, less than 6% are among the world's poorest. So there's a huge challenge for healthcare providers like CCBRT, local providers on the ground. We often talk about the clinical human resources challenge, but there's also a significant managerial challenge. So as many organizations like CCBRT have grown over the past 15 years from being small to meet growing demand, how do they do that in a way that is efficient? So CCBRT recognized a need and in 2012 began its lean management journey. What they were looking to do is to reduce waste, improve efficiency, lower the costs, and improve quality, ultimately improving the value for the clients, for the patients that come through the hospital every day. But they had a significant challenge with population growth, as many organizations do in the rapidly growing urban centers. Dar es Salaam is one of the fastest growing cities in the world. It's estimated that it will grow by 85% to 6.2 million people in 2025. For CCBRT, this meant that they were seeing more patients than they could serve. They were turning away approximately 80 patients every day for eye services alone. And this is really unacceptable in a country where 65% of the population lives on less than $1.25 a day. Patients travel from all over the country for hours or for days to come and see a qualified surgeon or doctor. And to turn them away is not an option. So they started with the eye outpatient department. And in October of 2016, they closed down the entire IOPD for an entire week, following months and weeks of very specific planning with program teams, bringing together the leadership, the middle management, and the nurses and the doctors on the ground to identify solutions. How could they improve the process? How could they improve the patient flow? When they reopened the IOPD, they saw results. They decreased the number of patients turned away by 72.5%, and they increased the number of patients seen by 21%. This is just the first step. So what we'd like to talk about today is how we can partner with other organizations who may be interested in doing the same thing. This project was the result of a 3-year grant from Human Development Innovation Fund, a £430,000 award that concludes in May 2017. We need funding to continue the next phase of rollout of this project. Our plans are to roll this out across other clinical departments and to establish a central improvement office which will institutionalize the changes that are underway, appointing value stream leads across each of the departments with which the central improvement office will work. We believe that there is significant potential not only to improve our own quality for patients and the number of patients that we can see as demand increases, but also for other organizations to learn. From a revenue perspective, as we increase the number of patients seen, we will increase revenue generated by paying patients. We also see an opportunity for training. Just at the end of February of 2017, just a few weeks ago, the CCBRT held its first Lean conference, which was attended by approximately 50 people. We see opportunity for more organizations to learn from the work that we are doing. What I hope to learn from the panelists, the expert panel judges today, is your advice on how to strengthen this pitch, on potential funders who may be interested in supporting our needs of approximately $150,000 per year for this continuous improvement effort to continue, and any other suggestions you may have for partners who might be interested in working with us and learning more. Thank you so much for your time. I look forward to speaking with you in April.